Okay, bus another packet. So I will be asking each faculty to come one by one when we are discussing the concerned subjects. So let me start with the open discussion now. Go with your patient. No course is inferior or superior in SS level. So how to select a seat? Let me give a basic doubts that the students might have. Let me give the basic doubt. The basic doubt will be, first one, priority number one should be the patient you actually had. For example, you are a neurosurgery aspirant and you are interested in neurosurgery. Don't change your patient. Now you got some good rank. Even if you are first rank, whatever you aimed before, you should go with that. Don't change it. Yes, MCH is one which is very useful only when you go with your patient. And number two priority you should select in the colleges is to look for colleges which have more cutting chances. Cutting chances in the sense, many places a DNB will have a good cutting chance, but I will tell you, if you get MCH, you take MCH in government institutes. Why I'm not telling not to take DNB? Because actually DNB may appear as if it is going to be 3 years. But when you join DNB, you will be finishing 6 months late than an MCH graduate. So it is around 3.5 years it will be going. So I'll tell you, if you are going to get MCH, go for MCH first option. So DNB as a second option, and very important, MCH is having always 100% pass percentage, and DNB will have 70 to 80% pass percentage. So first go for MCH, second go for DNB. I'm not telling DNB is inferior at this point of time. I'm telling you there are some little difficulties in DNB, but when it's MCH, easy to complete the course, easy to pass and come out in 3 years. Okay. Priority number three, MCH not there, please go for DNB. Nothing wrong. If MCH is not there, you should go for DNB. Don't change your patient. Okay. Don't change the patient, go for DNB. Payment seats under your patient. So payment seats, can I pay and join? So many times, many of you might not get a government seat or a DNB seat, and many times you might be getting a payment seat. Number one, if you can afford for the seat, please go for payment seat. If you can afford now, you can go. If you are not affordable, you feel that wasting of 1 crore money is very much high, you can always prepare for next time. That is a very important, simple priority. This is the protocol I always say in a counseling selection. Go for the course, whatever seat you are getting, the course, what you liked must be the first priority. Go for MCH government institutes, second DNB institutes, third go for private college. Okay, so MCH and DNB both are equal in present scenario in practice. So no difference in this. So don't hesitate to take DNB seat. Okay, so very important thing in the preparation. So what happened this year? So please remember the total appeared for a surgical group is 6302. The total people appeared for the seat is 6302, and cutoff eligible mark is 284 marks. Eligible until rank 3140. So there are totally 3140 people going to come for the counseling, up to 3140. And of these 3140, do you know how many number of seats are there? Please remember, from the old allotment list, it is 1,384. And this year we expect it can come up to 1,500 or 1,600 seats also. Many DNB institutes are opening, many new colleges have applied for the seat. Once applied seats also will be shown in the counseling. They will be recognized in future. That also will be seen. So definitely there will be an increase of at least 200 seats will be happening this year. And the total candidates are 3140. So among the 3140 candidates, one of the 2% is going to get a seat. If you are going to allot for any seat, one of the two might be getting a seat. So mostly what happens, people will see for next bond. So bond is one dangerous problem in the MCH. Many states have made bonds in such a way they will restrict other state people to enter into their state. It's actually a very bad thing. It should not happen, because if this is going to happen, an open seat cannot be taken in many places. In fact, it is a difficulty for even the same state people. So I can tell you, in Tamil Nadu, we have a bond of, this PPT will be shared, so you can use it. Tamil Nadu has a bond of 2 years bond with a 50 lakhs or else 50 lakhs we have to pay for the government. So this is 2 years bond. There is an important glitch here. So last 2 to 3 years, there is no vacancy for private candidates in government institutions in the place of their specialty. So please remember, as per the government norms or as per the bond, already Supreme Court have won a case, you can be used in the bond only when there is a vacancy for your specialty. Many states like that don't have a vacancy in their specialty. Especially Tamil Nadu, there is no vacancy in your concerned specialty. So you might not be made to work under bond. But After 2 years only, they will give you the degree certificate. Don't worry about the degree certificate. You can go and work somewhere else with the provisional certificates, and after 2 years, you can release your certificates. There are many such places where the bond is not so strictly followed. In fact, the bond, they are unable to accommodate the students as per bond, and you can go out without any bond easily. So please remember, very important, Delhi colleges have no bond. So I will tell you, prefer Delhi colleges because they have no bond and a good stipend also. And some other colleges will have very less bond, like 1 year only. Kerala, they have only 1 year bond. In fact, you can work peacefully there for 1 year. Maharashtra, 1 year. Kerala, 1 year. Rajasthan, see how they have made a very long bond of 5 years. And some other institutes like Uttar Pradesh, there is no bond. Telangana is 1 year bond in Nizam Institute and 2 years bond in other institutes. So you can select the institutes. I will tell you, if there is only 1 year bond, you can easily join there. It will not be a major time. You will easily spend the 1 year in the same state without much difficulty. You can join in 1 year bond. Okay. So actually, all the faculties are here. I'm going to now start discussion of one by one. I'm starting with gastro. After gastro, I will be calling the onco, urology, like that. One by one faculty will be coming. So as per allotment list last year, reducing the government quota seats. So you all very well know, Tamil Nadu, there is a 50% seats going to government students, government service candidates. So now in total, there are only 129 effective seats. It may increase up to 140, 150 this year. Okay, it may increase up to 140, 150 this year. And what are the colleges to be preferred in gastro? So friends, you can now post your doubts related to gastro. And other faculties' doubts, you can post at that time, they will answer your query. Okay. So I'm seeing any queries from gastro so far. Yeah, I'm seeing the questions from gastro. So far, so more questions are in urology. So we'll be discussing about them. So please don't post in question answer. Please post in chat. Please post in chat thing. Okay. So anything related to gastro, up to which rank government MCH colleges are gone. So you can see this is a last year seat. You can see starting from GB Pant. Usually the students, top rank people will prepare GB Pant, SGPGI, and KGMC Lucknow, and most important, ILBS. So you can see JIPMER is filled, GB Pant Hospital is filled first important. And this fourth rank student, I still remember, he is from Kashmir. So he took from Kashmir. Last year, he took a Kashmir last year. He's our student. And Indira Gandhi Institute, MCH, IGMC, Indira Gandhi Institute, Christian Medical College, ILBS. You can see Sanjay Gandhi. Trivandrum is filled by some of the Kerala students. And usually, GB Pant, SGPJ will be more preferred by most of them. Stanley, a few students filled here. So I'll tell you, the number of cutting chances in Tamil Nadu medical colleges are very, very less. They have very less cutting chance in Tamil Nadu. So you have to prefer first option. If you're a top ranker, you must prefer institutes where there is more good cutting chances. Okay, so go for Delhi institutes. Whatever the Delhi institute you prefer, the Delhi institute first. Then you can go for other institutes like state top colleges like Stanley Medical College, Madras Medical College, Madurai Medical College. All these colleges you can go next level. So all this is a list of rankers last year. You can see the government seats went up to around 78. Even 85 is a government Kilpak Medical College, and many government college in Srinagar, Kashmir, 91. So it depends, because at least 75 to 80 government institutes are there. So it depends upon the students who prefer. For example, a Kerala student will prefer more of the Kerala colleges. Even if it is a DNV, they will prefer instead of going for a private institute. You can see 105 rank. Gem Hospital is a very good institute in Coimbatore. Most of them fill here. And so many hospitals, according to private hospitals, also some hospitals are very good. So you should not hesitate to take private hospital if you can afford. Okay. So this is a question. For MCH gastro, I'll tell you, up to 200 rank, in the first to 200 rank, you will easily get into government seat. And up to 200 to 300 rank, you may get in DNB. After 300 rank, you might only be able to get into any private colleges only in gastro. Because many toppers are also preferring onco surgery in the beginning, first 100 rank. So I know at least 40 students are appearing for onco in the first 100 rank. So therefore, gastro will go up to 200 in government institutes, and from 200 to 300 in DNB institutes. And after 300, you will be having little difficulty in getting a gastro. And mostly, maximum, gastro will move only up to 400 in various private institutes also. See, even this Dhanlakshmi Srinivasan College is the first batch. Even this college got filled last year at around 400 rank in gastro rank list. So please remember, you have to know the list of colleges and prepare a good seat. Okay. So gastro aspirants, it's a clear cut. There are only very less number of seats, 129 seats, and you can easily guess which is best, which is worst from this list itself. This is the list actually we had last year. As per this list only, the colleges gets filled. Okay, will get filled. So DNB has no bond. Why should they get a bond in DNB? DNB has no bond. Private colleges have no bond. That is why when some students ask me, sir, what can I do? Private college 1 crore. I will tell them, if you're going to join in government institute and working for 3 years or 5 years, you might not be able to go out without paying the bond amount of 50 lakhs. So in such cases, if you can afford now, you can better pay in a private college, finish off and come out of this hell of preparation. Okay. This is the suggestion I give for most of the students. So now let me ask Dr. Balaji sir to come into the Balaji sir and Dr. Nilesh. We have 2 oncology faculty, oncosurgery faculties are there. We are going to call them now. I have to make them as admin once again. Sorry for the confusion because of this thing. We had so much confusion of getting into the. So, Dr. Darius, please make Dr. Balaji sir as Dr. Balaji sir is in the link. You can make him as admin.
Sir, I have joined.
Dr. Nilesh has joined. Dr. Balaji sir, please join.
Sir, I have joined. I have joined. Dr. Balaji.
Dr. Balaji sir, you will be coming at the neurosurgery. I'm calling Dr. Oncosurgery Balaji.
Okay, thank you.
Yeah, you will be coming under neurosurgery. Oncosurgery, Dr. Balaji sir, have you joined?
Sir, I am there, sir.
You are there, Nilesh. I saw you. Just I'm seeing for Dr. Balaji Ramani sir. I'm making him now as a panelist. Dr. Balaji Ramani sir. So now you can ask all your doubts about surgical oncology. Nilesh sir and Dr. Balaji sir, I will be asking you the doubts asked by the students in the chat box. I think Balaji sir has been made as a panelist. So Balaji sir, I think Balaji, thank you. Sir, please join. I welcome Dr. Balaji sir, our faculty for offline centers for the past many years, and he's a leader of surgical oncology team. And I welcome Dr. Nilesh sir, our online faculty. So they will be clarifying all your doubts. So Dr. Balaji sir, how is our surgical oncology in Adyar Cancer Institute? One question from a student Aparna.
Yeah, so first I'll give you a general this one. Is screen sharing enabled here?
You can enable yourself. I will stop sharing. You enable yourself. I think you are a panelist. You can enable the screen share. So friends, here Dr. Balaji sir and Dr. Nilesh sir, both of them are here for clarifying about your doubts about oncosurgery related colleges. I will be telling your queries to them. Yeah, please tell sir. Please, Balaji.
Yeah, going ahead with the general impression of what is there in MCH surgical oncology. Now, this is the MCH seat matrix in surgical oncology that we could gather. Totally speaking, there are about 29 institutes with 118 seats in MCH. And if we take up DNB surgical oncology, there are 99 seats distributed across 50 different institutes. So this is the distribution. So all put together, we are having 207 seats, as already Dr. Rajamahendran has put up. Now, the same questions come repeatedly, like, what is better, whether it's MCH, whether it's DNB, whether I get it in a good institute, whether I need to go for a different institute, is it okay? So these are some common questions that we ask. Now, general rules always apply, as Dr. Rajamahendran already said. Whenever it is feasible, go for a government college MCH seat. That is the first option. There will be certain instances where doing a DNB from a private instance, from a private institute will be better, but it is only in select cases. And one other question that many people have is, if I do DNB, the pass rate is very low. So, can I do DNB? Even if it is from a good institute, the pass rate is very low. Can I get a pass? Will I stay for another 2 years or 3 years? Now, the reason that we have, as far as DNB is concerned, why people do not pass is very simple. Because the exam pattern, the clinical and the theory part, everybody will pass. That will not be an issue. The problem will come in the clinical examination. Now, in most DNB institutes which are awarded in private hospitals, you will not be seeing the patients at all for 3 years. Like, for example, at the former place where I was working at Apollo hospitals, we have one DNB seat every year, but the students, the DNB candidates never come to the OPD. Their work is entirely restricted to the operation theater and to the ward alone. So the initial evaluation of a patient never happens by the postgraduate. We all know, many of us have come through government institutes where entirely the OPD will be handled by us. So we'll be seeing about, about 20 patients, 30 patients each, at least in every admission day, bare minimum. We'll be seeing them, we will be evaluating them, we'll be giving the investigations, writing the case sheet, everything will be done by us. So every patient becomes a practice for you. So when you go for your exams, practice is already done. So when you present the cases, it will be easy for you. But when you are a DNB candidate for 3 years, you have not presented even a single case, or just before the exams, you will just present a few cases. But that practice of taking a history, writing the investigations, how to go about all this is completely lacking in many of the DNB institutes. So this is what you have to think about. There are some private institutes which offer DNB, but if you are handling OPDs, these are some of the things that we need to find out with regard to the institutes. Now, if you discuss the colleges as far as MCH is concerned, all of us know that, Tata is the top institute with, 24 seats that we have. Then we have Kidwai with 11 and BJMC with 10. All the others ranging from 5 or 6 seats across various places. Now, the top institute that many of the people will prefer is, of course, Tata Memorial in Bombay. No doubt about that. It's the apex institute in the whole country. You get a good exposure. But one word of caution, currently, because there are 24 postgraduates every year, that is 72 PGs at a single point of time in Tata Memorial. Plus, you also have MCH in head and neck oncology, you have MCH in gynae oncology. Now, let's say you have a person who is doing MCH in head and neck oncology and he gets a rotation. You get a rotation from surgical oncology in head and neck. Now, one person is going to stay for 3 years with the professor, whereas you're going to come for 3 months or 4 months rotations. Then you will go to gastro, then you will go to thoracic, like that. It will be there. So the cutting chances, this is from Tata faculty and Tata alumni. I have personally noted that the cutting chances at Tata are now far less than what it was before. Previously, in every posting, let's say for a composite resection, each of you would be doing somewhere around 5 to 10 cases before you come out of your first posting. Now, altogether, they hardly do 4 or 5 cases when they come out. This is the real life scenario as far as Tata is concerned. So that is one word of caution. This is again not saying that you should not take up a Tata, because the advantages are far, far better than the disadvantages. But we have to have this in mind that the Tata cutting may not be as great as what it was previously. Now, the order of sequence, again, for most places, it will be Tata first. And then, you have your Gujarat BJMC, which is again a good institute as far as cutting goes. Kidwai is, kind of so-so. In some units you will get, in some units you may not get that level of exposure. That way, currently, if you look at Adyar is a great place for MCH currently. The cutting chances will be somewhat average only, but the advantage will be you now have exposure to robotic surgery. Like at Tata, you have exposure to robotic surgery at Adyar Cancer Institute. The same way, again, when you go to, places like Indo-American and all that, you will have exposure. So, like a DNB institute, which is very good if you want to say, it's probably going to be Indo-American Cancer Institute. General rules, Tata will be first, then it will be BJMC probably. Other institutes which you may not be knowing about, I'll just probably go down one by one in this list so that we do not miss anything. The first institute which I have put up in the list, this is according to the alphabetical state order. So SWIMS is the first institute, Sri Venkateshwara Institute of Medical Sciences. This is like kind of the government institute as far as, it's there in Tirupati. So you will have a good exposure to a basic number of cases. All these cases will be done there in quite a huge number. Cutting chances are, as far as I know, it is average to low. It is not very high, and you will do all the basic cases before you come out. B. Barua Cancer Center in Assam is one of the best institutes in oncology in the country. You will have a lot of patients there, and currently they are doing all high-end surgeries, like, including HIPEC. HIPEC has been recently started there. So all kind of surgeries go on, and Northeast is generally an area, a hotbed for cancer. Many patients come there with cancer. Not too many institutes for treating cancer as well. So that is again a great center now, as far as you can take. Cutting chances will be average, I guess, but the case exposure is going to be pretty good. I have my own, colleague who is working there, Dr. Gaurav. So, the institute is quite decent as far as the exposure goes and as far as the cutting chances go. Guwahati Medical College is lesser than B. Barua, but if you are coming from that part of the state, then yes, you can definitely take it up. BJMC, Gujarat, again, you will have a great exposure as far as cutting chances are concerned. Academics are so-so. The principles of oncology, which are very important, may not be really that well taught as far as Gujarat is concerned, but it is still better than many of the other institutes that are there for taking up. Now, Belgaum, this I have heard from one of my friends who is there. Belgaum, you will have a decent exposure to cases. Cutting chances, not that very great is what I heard. But any government institute in general, the caseload will be pretty good. So you need not be afraid as far as that is concerned. Kidwai, again, cutting chances are decent. Caseload quite decent, but academics not so great. MS Ramaya is a private institute. So if you're able to afford and you can go, then yes. But the exposure will be pretty good as far as MS Ramaya is concerned. And academics, you will have a lot of exposure because quite a number of good faculty are available there. But cutting chances will be average to low only. St. John's again is a private institute, so cutting chances will be very low here. But again, your exposure and your academics will be pretty good here. Vaidehi, again a great institute because one of the private sectors where you have a good exposure to oncology, whether you have quite a good caseload, you do limb salvage surgeries, high PEC, all that is also done there. But I believe the fees is quite exorbitant, almost 1 crore or so, if I'm not wrong. So how many people will be able to afford it? Now, Dr. Rajamahendran mentioned that if you have money, take it up. My personal belief is, unless you're getting into a government college seat or, in that range, do not get into any institute which is going to charge huge amount for your MCH. I'll rather say you put it in the bank, get the interest out of it. You will make much more money out of it and far less, loss of peace of mind. You can try again and get it in a better institute, or you can take it up even in a DNB college where it will be better without too much of a fees. Because except for very few institutes, it may not be worth paying so much of money like 1 crore or 1.5 crores. And see, whatever be the earnings that you make, you're not going to make it in any point of time. And so if you want to take a loan or something and get in there, definitely I would not advise you to get into any of those institutes by paying a very high fees. Yenapoya, again, that is a good institute because Dr. Vijay Kumar is there. He's one of the nice faculties which is available for surgical oncology. But overall, if you look at it, still it's a kind of private institute. So the cutting chances and everything will be relatively average only. Aurobindo Indoor, I have no clue. I need to inquire and find out how good the place is or what is. Now, I actually came back only today from abroad. I just came back yesterday late night, and so I am not yet fully prepared. This is just the list that I could get and some inquiries I have made. So the rest of it, I'll give you an updated list because you can see right here that I'm having a list where you can see, fees, bond, academics, cutting, future contacts, everything is something which I need to fill up for most of the institutes. So I'm just giving you a verbal thing. I will share this Excel sheet also with you later. Whatever is available right now with me, I'm telling you, or whatever I know of. Aurangabad again is a decent institute. It's a government college, so exposure will be good. Academics, not so great. Cutting chances will be fairly decent because Maharashtra is a good place generally for cutting. Tata, of course, we already discussed. Again, Acharya Harihar Katak is something which I don't know much about, and same thing with IMS, SUM and Orissa. Both these places I'm not well aware. I will inquire more and tell you. Now, Mahatma Gandhi in Jaipur and SMS in Jaipur, both these places have pretty good exposure. Both of them are government hospitals. SMS in Jaipur is well known for cutting chances as far as surgery is concerned, and MGMC in Jaipur is also one of the institute, Mahatma Gandhi Center in Jaipur. Both these are well known for receiving a lot of oncology cases. You will keep doing a lot of cases. The work will be toxic, but then the principles may not be so much because it is more of work related thing. But if it is just cutting that you're looking at, definitely those two places will be good. Adyar will give you a good foundation in oncology. Cutting chances are average. Advantages I will probably say is with regard to getting exposure to robotic surgery currently there, and the principles of oncology will be absolutely spot on as far as Adyar is concerned. You will learn what not to do definitely as far as the management of patients is concerned. Chengalpet again in Tamil Nadu is a new institute, like it is attached to Karapete Cancer Center. It's actually in Kanjipuram, though it is mentioned at Chengalpet, it is actually near Kanjipuram. So what we find here in Chengalpet is we will have quite a good exposure to basic surgical oncology cases. But again, academics and the post-op care, all this leaves a lot to be desired. High-end cases will not come here. Most of them will be shifted to MMC or to Adyar from there. So that is not going to happen. Coimbatore, again, the surgical oncology department has been present for quite a long time. Exposure, okayish, and again, cutting will also only be, as Rajamahendran already said, the cutting in TN in many places will be average at best, not beyond that. Roypeta is a good institute. That is again one institute like Adyar, which has been around for a long time in oncology. So the exposure, they do quite a wide variety of cases, HIPEC, limb salvage surgeries, everything is getting done here. So that is again a good institute which you can take up. No need to worry about that at all. MMC Chennai is a recently started institute associated with the super specialty hospital at Omandurar. Again, one other advantage that you have here currently is the presence of robotic surgery. Recently, a robo has been installed. It's one of the first government institutes in the entire country to get a robo. So you have robotic exposure, and the faculty there is very good in lab surgery. So robotic will be just a step away. They are already doing quite a bit. So that is also something where you will have an exposure, and pretty decent chances, fairly good exposure will be there again in MMC Chennai. Madurai again, fair exposure to all the basic cases. You will have all of them getting done here. Problem may be with relation to cutting charges. The faculty there are all pretty young, so like young assistants, they will tend to do a lot of cases. You may just be the first assistants in many of the cases. That may be the problem that you will have. Ramchandra in Chennai is again a well-known institute for both the undergraduate and postgraduate studies. The course in MCH has been recently started there because Dr. Bose is one of the senior most faculty in entire surgical oncology as far as India is concerned. Sorry. So he is there, but again, the caseload is only okayish. It is only his personal cases that come a lot there. Other cases, not so much. And again, the faculty will be operating a lot more than you will be doing. So your exposure is going to be limited as far as the cutting chances go in Ramchandra. Osmania Hyderabad is, of course, the best center as far as Hyderabad is concerned. No need to worry about this. 100% you can take this associated with I think it's the Gandhi Hospital, if I'm not wrong. So there you will have the hospital, and this is the best institute as far as Hyderabad is concerned in the government sector. Same applies for BHU as well. In fact, BHU, one of my seniors and my colleague Dr. Karthikeyan trained from BHU. At that time, they had quite a good exposure to chemotherapy protocols, including treatment for lymphomas and all that as well. You may not think it is so important when you're doing surgical oncology, but at times it pays to know a bit of chemotherapy, especially if you're going to go and settle in a peripheral hospital in areas where a medical oncologist may not be available. It is very, very useful to know or have exposure to BHU. The same thing applies for Roypeta, Chennai as well. Kilpak, Roypeta, also you will have a fairly good exposure to chemotherapy. Then KGMC Lucknow, one of my close colleagues, Dr. Siv Prakash, he did from KGMC Lucknow. Again, a great institute, including thoracic cases. Everything is done there. I think, if I'm not wrong, Dr. Sameer or somebody is there now. I don't know him personally, but generally speaking, KGMC Lucknow will have a very, very good exposure to cases. Fair bit of cutting chances will be there, and you will be basically handling every bit of the basic cases. Advanced surgeries, I'm not so sure. Like, exposure to other allied specialties like endoscopy or HIPEC and all that, KGMC is not well known for that. RML Lucknow, Ram Manohar Lohia is a good institute for UG and postgraduate institutes that I've heard, but I'm not sure about surgical oncology. I don't have an idea. Neither do I have an idea about Himalayan at Dehradun. These two places are kind of unknown to me. I will find out more and I will let you know. Now, the next question, this is all with regard to MCH. The next thing happens is with regard to DNB institutes, which are the places to take, which are the good ones in the list. So I will just probably list each one separately. Action Cancer Center in Delhi, no idea. Apollo in general, I don't know about Apollo Bangalore. Mumbai is a recently opened center where you have Dr. Anil D. Cruz, who is there, who's head of head and neck oncology in former head of head and neck oncology in TMH, and he is a very great surgeon. You will have quite a bit of exposure to head and neck oncology as far as Apollo Mumbai is concerned, and that is going to be there. But as with any Apollo branches, cutting chances will be very, very, very minimal. You will probably do an MRM before coming out, maybe some neck dissection, that's all. Hyderabad, Ahmedabad, again, all these places, whenever it's an Apollo brand name, because the patients will all be high-end private patients most of the time. So cutting is going to be fairly limited. And again, more importantly for you, the evaluation of the patient will be almost zero. You will see the patient directly after they are admitted for surgery in the ward. So you will not have an idea of how to go about examining the patients or how to take a history. Now, one piece of advice for people who are planning to take up DNB, whichever place you take it up, make it a point to examine the patient and write a case sheet for each and every patient right from the day you join, and keep up that practice. If you do that, then the chance of you clearing your clinical exam is going to be far higher. That is the only advice that I will tell as a general thing for anybody who's going to join a DNB course anywhere. It applies anywhere. It doesn't matter whether it's oncology or gastro. Wherever you take it up, do this as a routine. Apollo Chennai, again, excellent exposure, top to bottom, all cases you will see, including pretty advanced cases. Everything is going to be done here. The only disadvantage, as I already said, is the hands-on is going to be very limited. You will not get a hands-on at all. Here, HIPEC is done, limb salvage is done, robotic surgeries, skull-based surgeries, you name it, anything in oncology, thoracic, complex re-explorations, everything is done in Apollo. The only thing is, again, the hands-on will be very, very, very limited. R&R Delhi is associated with the Army Hospital. Generally a good exposure, fairly good exposure and decent cutting chances. But I heard there is a big bond as far as R&R is concerned. I think it's something like 5 years bond or something. So just look into that. That part may not be very appropriate. If you want to take up something in the Delhi area, then the best one is probably going to be your Rajiv Gandhi. Rajiv Gandhi is a great center in Delhi where you will have 4 seats and pretty much decent exposure to all the kind of cases, hands-on evaluation of patients, everything will be there. It's like almost equivalent to doing MCH. So if you look at the institutes here where you can probably, I'll just list out some of the institutes which might be good, similar to doing an MCH. R&R Delhi will be good. I have heard that Bhagwan Mahavir Cancer Center in Jaipur, again, you will have a pretty good exposure. You will be almost working alone like a consultant. Bombay Hospital, personally, I've actually joined MCH Urology there before I took up MCH Oncology. So they have 2 blocks, something like a private block and a public block will be there. So I think fairly good exposure to surgical oncology should be there. And you do get chances as well. I don't know particularly about surgical oncology, but for urology, I can definitely say cutting chances are there because this is way back in 2008, 9, I have seen. I was there in 2008, if I'm not wrong. So at that time, I did a fair amount of cutting myself in 1 month, which I was there. I already did a few cystoscopies. I assisted in radical prostatectomies and all that. Being a first-year resident, just in the 1 month I was there in urology. Oncology might be similar because of the high exposure to cases that you will have here. Kachar Cancer Center, again, close your eyes and you can take it. No problem at all. That is the place where you have Dr. Ravi Kannan, who is kind of like a god of oncology as far as people from Adyar are concerned. And he is Padma Shri awardee as well. So he has really turned around the center. So exposure to cases, HIPEC, all these kind of surgeries, limb salvage, everything. I know all the faculty there, Dr. Ritesh, Dr. Palomi, all of them are, people who have trained either from RCC or from Chennai Adyar Cancer Institute. So the cutting chances, the exposure, all this will be excellent. So this is again one other center where you can definitely take up without thinking. Dharmashala, again, I have heard is a good place for doing DNB. BL Kapoor is kind of okayish. So it will be way down the list as far as DNB is concerned. Then if you go down, GKNM Coimbatore, again, you will have a fair bit of exposure as far as oncology exposure is concerned, maybe a bit of hands-on as well. And among HCG hospitals, I'll probably say HCG Bangalore, there you will have a fair bit of exposure as far as the management of patients is concerned. So Indo-American, again, probably one of the apex places where you can take up excellent exposure, excellent hands-on, more so as far as minimally invasive surgery is concerned, thoracic, abdominal, GI, your, all laparoscopic surgeries, everything is very, very, very well done here. So Indo-American is one place where you can, if you get your DNB, you can take it up without thinking too much about it. Now, other than that, again, KIMS is a reasonable center. I'm not, sure like how great it will be. Then Mahavir Patna, Mahavir Cancer Center in Patna is again one great place where you will get fair bit of exposure and cutting chances as well. Malabar Cancer Center is again a great place. Malabar Cancer Center has got Dr. Satishan from Adyar Cancer Institute. Even at Adyar, he was one faculty who always believed in giving a first-hand exposure to students there. Okay. You can just note this down, guys. I'll share the Excel in the case sheet. I'll share the Excel file with you. You can just note down the places which I'm telling. Okay. I'll just repeat it for now. Probably you can take it as R&R Delhi. Then you have Mahavir Cancer Center Jaipur. Then you have possibly Bombay Hospital. I need to ask about oncology. Urology is very good in Bombay Hospital, Maharashtra. Then Kachar Cancer Center in Assam. Then Dharmashila in Delhi. Then you have GKNM in Coimbatore and HCG Bangalore Institute of Oncology, Bangalore, Indo-American in Telangana, and then you have MG Vizag. Mahatma Gandhi Vizag is another great place. So that is again one place where we can have a good exposure. Mahavir Patna is good. Malabar Cancer Center in Kannur is good. No, I will share the Excel file. I'll share the Excel file, guys, so don't worry. I'll share the files. I'll probably highlight it and send it as well, so don't worry. This is just a session where you can settle your doubts and, kind of know which are the centers. You just hear the name. Manipal, again, you will have a great exposure. Everything, I mean, currently, though, Just think about it, because Dr. Somashekar, who was there in Manipal, is no longer there in Manipal. He has moved to Aston Medicity. So right now, Manipal is a query. Till last year, no doubts about it. You can definitely take up, because a lot of cases you will get. Now, Dr. Somashekar is no longer at Manipal. So that is still a query whether you can take it up there. One other center which many people may not know about is MBR Calicut. MBR Calicut in Kerala, excellent center. Not many people would have heard of it. It's a very nice place. All the faculty, almost everybody is from Adyar Cancer Institute, and many of them are either my senior or my juniors. And you get quite a wide variety of all cases that get done here. Protocols are followed. You will see hands-on patients, hands-on surgeries you will do. Everything will be pretty good as far as MBR Cancer Center in Kerala, Calicut is concerned. And Nizams as well, because Nizams, even when at the time when I was doing or thinking of joining MCH, even at that time, they had a senior resident program and DNBS program in both in CTVS and also in Onco. Both these courses were supposed to be good there. So Nizams is again another great place where you can do it. Now, Rajiv Gandhi, I already told, no need to think about it. Closed eyes, you can take up Rajiv Gandhi in Delhi. Now, Ruby Hall in Pune is again a recent center where, one of my friends is working. So there, you will have a good place to take up this one, because you will have a good exposure. Hands-on, I'm not so sure, because that is again a completely private hospital. So that is again something which I'm not aware. The next centers which I will think about, I'm not sure about this Inlax Budrani. I've heard that name a lot, but I don't know about the actual hands-on or cutting there. Saroj Gupta, Kolkata, Sher-e Kashmir. Sher-e Kashmir may be good for people from that region. If anybody is here from Kashmir, then they can definitely think about it. They will have a, good this one, because I think it's a government institute. So you will have a great exposure there. Then you have Tata Calcutta. Again, TMC Calcutta, you will have an excellent exposure. It's a branch of TMH. It's known as Tata Medical Center in Calcutta. So here you will get a wide variety of patients. Excellent exposure will be there. All the basic cases is going to be very well covered as far as Tata Calcutta is concerned. So that is again one center where you need not think about taking your DNB. One new center which is again here is going to be your Thangam Namakkal. Now, Thangam Namakkal is mostly manned by faculty who are all from Tata. It is Dr. Saravanan Rajamanikam, Dr. Deepthi Rajamanikam, Dr. Aruna, Dr. Bhavesh Puladia. All these are the people who are there in Thangam. It's mainly focused on academics. They do things according to protocols. You will have a lot of exposure to wide variety of cases. And recently they have gotten the robo as well. So everything is available there. In short, from head to foot, you can, do everything at Thangam Cancer Center in Namakkal. So that will be a great place for you to join, because this is one place where you have it all, guys. Now, again, the same thing goes for Yashoda, Secunderabad and Hyderabad. Good exposure to cases, though they are again completely private hospitals. So hands-on, again, it's something like the Apollo of Hyderabad, Apollo of Chennai. So you will have a good exposure, but, we may not be sure of how good your chances of cutting anything will be. So these are some of the things. Now, as far as the, what you can say, just 1 minute. I'll just give you a new screen sharing. Sorry, not that one.
Meanwhile, Dr. Nilesh, sir, you want to tell anything about the queries from the students?
Sir, already Balaji sir have covered everything, sir.
Yes, covered everything. Among the
Yes,
queries
sir.
the students
But
are asking?
one thing I want to mention, sir, here. Thing is that you can set your priorities according to colleges. What sir have shown in PPT, that according to that you can prioritize. You can make priority for your colleges. Like you can make like TMH as a first priority. You simultaneously have to see the bond also and what is the stipend. But some places where you can get only 1 year bond is there. That places you can choose for your MCH. Like TMH is there. After that, 2 more good centers is there. Like sir already explained, RDR is a good institute. There is some good seats is there. And Kedwai is a good institute. RCC Trivandrum is a good institute if you are choosing for RCC Trivandrum.
After that, are asking about Harkinsandas, Mumbai.
Sir, this is, I think, sir, some new colleges there, but some students ask for Mch super specialty in Delhi. you can choose for a DNB surgical oncology. That is a good institute.
Okay.
And you can go for that. Sir already told RNR Army Hospital is there for DNB super specialty, and you can choose for Rajiv Gandhi Institute. That is a good institute for exposure. And with that, you can go for Indo-American is a good institute for getting DNB as an option. Because if you are having any college which is having high fees, you are not able to pay high fees, you can choose this institutions as your first priority. You can get the same exposure only. So these institutions are having comparatively good exposures and good cases. So according wisely, you have to choose, and according to that, you have to opt out. It is not like that MCH or DNB. That depend on your choice. You want to practice an institution or you want to practice some private practice you want to do. That depend on your basic choice. But there is no any too much differences there between MCH and DNB. If you want to pursue with a good institute, you can go for DNB surgical oncology also in the preference of MCH surgical oncology. There is no any harm to get DNB super specialty.
Okay, thank you, Naresh sir.
Yes.
Up to what rank can we get onco surgery seat? This is the most of the question. Up to what rank we can expect onco surgery seat?
Yeah, that is something like
gastro I told up to 200. Now you should tell what is.
It's like, it means it as plus 200. Somewhere in the top 400 to 500, if you are there, then you're likely to get a seat in, surgical oncology somewhere. Either a TNB or a MCH, you will definitely get. See, because as RRM sir already told, most of the people will choose, either onco or gastro in the top 200 to 400. That is the range. Many people, it's almost like a 40% will go for onco, 40-50%, and 60% nearly will take up gastro. So that will be the split in the top 400 to 500 ranks. So till 500, definitely there is a very high chance. In fact, last year, if you look at the allotment list, the rank which was given was, it's 1080. Let me refresh the allotment list.
Yes,
yeah, oncology till 1062 we were getting it. Saptagiri went at 1062, but most of them are, finishing around the 400 rank. Around the 300 to 400 rank is where we are generally getting over as far as both gastro and onco are concerned. Beyond that, it is a little difficult. Those institutes may not be worth it unless you know for sure there is a great place and you are able to afford the fees and it's not a problem. All these, see, Vaidehi, for example, is a great place, but then the fees is sky high. I personally don't know whether I would recommend Vaidehi just for the simple reason. I heard it's almost, 1 crore as far as
mostly 1 crore, sir. Most of the private institutes are 1 crore.
So that I will actually say better to go for a DNB institute. So, this Excel I'll be sharing, guys. So that is fine. And
because of want of time, we will not be able to discuss everything. We will be sharing you the Excel sheet.
Yeah, sure. Yeah. We'll go ahead with the other specialties, I think. Yeah.
Yes, sir. Other faculties are also waiting. Thank you. Thank you so much, sir. Thank you, Malaj, sir. Thank you so much. You can stop sharing your screen, sir.
Yeah.
Yeah. Now I welcome Dr. Balaji and Dr. Sajid for neuro. Please make yourself active, right?
Good evening, sir, Dr. Balaji Neuro.
Dr. Balaji Neuro.
Yeah, I'm here, sir. Can you hear me?
Dr. Sajid Stephen Neuro.
Hello.
Yeah. Both of you are alive?
Yes, sir.
Dr. SSK, sir, are you there? Dr. SSK, sir. Saravana Santosh Kumar, sir. Our faculty, neuro faculty. I'm unable to see SSK, sir. I think he has not joined here. So please tell about neuro seats and all, sir. Please tell. So dear friends, most of you are asking gastro and onco. We already have posted them. We have already posted the list of institutes to be preferred. We'll be sharing you in the group, so don't worry. Please tell Rajib.
Yes, okay. Hello, friends. So neurosurgery as a profession, it's like neurosurgery training will be very difficult for the next 3 years. So you have to expect, work-life balance will be minimum. There won't be, you will not be having free times and time to roam around and all. So it's going to be a tough 3 years for you. So you have to be prepared for that before going into a super specialty stream in neurosurgery. Coming on to the institutes, see, actually I'm out of station, so I haven't prepared the slides and all. I'll just give you an outlook, and I think Dr. Balaji will speak on that. So it's like you have some institutes there in that is coming under NEET SS, as well as the state seats. In the institutes, there is Nizam, which is in Hyderabad, which is a very good place. You get a good amount of cutting, as well as the academics is really good there. The HOD madam is really nice. And coming on to the hospitals, medical colleges. I'm from Kerala, so I can start with Kerala. In Kerala, you have institutes in Trivandrum, Calicut, Kottayam, and Alapi, Thrissur. So these are the government medical colleges. Among which I have done in Trivandrum. So Trivandrum is like my hometown and my place. So it's like 6 seats are there. Good amount of cutting chances are there, and you have a very good department. It's like they give a complete training. So it's not just the cutting chances that you get. They will prepare you for pre-op care, post-op care, as well as the OT chances. Emergency chances are really good. Routine, you get minimum amount of cutting there, and the department is in a very good state now, because you have 4 microscopes, neuronavigation, everything that institutes have. And along with that, the medical neuro team have a intervention suite as well, so you will get a good amount of exposure there. In Kerala, actually, the only thing is it is not that resident friendly department. Good amount of toxicities there. You have a very bad work culture. You hardly get to sleep, because you have 2 ICUs that you have to manage and everything. Like probably you'll get 4 or 5 hours to sleep in 100 hours duty times. So it's pretty hectic there. And in case of a better resident friendly will be Kottayam, but there are only 2 seats. They are usually taken up early. So Kottayam has a good routine exposure as well, but the training is not as good as in Trivandrum, but it is okay. And then it will come like Calicut. Calicut also has 2 seats. It's good amount of cutting and exposure is there. Then you have Thrissur and Alappuzha. They have good amount of exposure. You'll get emergency cutting and all. Routine, not so much. And coming on to Tamil Nadu, I think Balaji will speak. In Karnataka, you have since you have NIMHANS there, Bangalore is not a good place to do neurosurgery, because almost all the cases go to NIMHANS, and then there is a private St. John's is there. St. John's is a good center, but just the case that there is only 1 seat, and that is remaining vacant most of the time. So your work will be more. Work will be more, but there are good amount of cutting chances there. One of my friend, Dr. Vinayak, is working there. Then you have if you are in Delhi, it is like if you consider in northern states, you have SCBGI in Lucknow and KGMU. They both are very good centers, and there is one center that usually go unrecognized, this Jabalpur. So Jabalpur, there is YR Yadav sir, who is a very renowned neuroendoscopic surgeon. So if you get a seat there, if you are from that area, you can definitely go for Jabalpur, because you will get complete exposure on neuroendoscopy, which is not at all there in other centers. So we all go there for fellowships in Jabalpur. So if you are from northern part of India, you can definitely choose Jabalpur or others. Then SGPJ is really a good option. Just that Sanjay Bairis are left to Chitra last year. See, he's the director there now. But still, the department is really good. They have a very good neurosurgical setup. Every gadget is there. They do all the ultramodern things. Then you have CMC. In private, though it is in private sector, CMC Vellore is a really good option. Like if you really want to do a neurosurgery residency, you can go to CMC Vellore because it is one of the first departments in India. Vedandam sir is the HOD these days, but it's a really good center. Only 2 seats are, I think only 2 seats are there in NEET SS. So, and coming on to state government seats, like you have in Madhya Pradesh, you have other than Jabalpur, you have Gwalior. Gwalior has some 9 seats. It's okay. You will get good amount of surgical exposure there, and all the colleges in Bombay are good. Like Seth is the best center. There previously the HOD, he was into all the C1, C2 fixations and everything. So Seth will be the first option, and the other colleges have 2 seats. Like 2 seats, the work again, the work-life balance will be very difficult. In Rajasthan, you have SMS. There also the number of seats are more. Like you have 10 seats there. But SMS Jaipur will get a good amount of cutting. And West Bengal, IPGMR is the best center in West Bengal if you talk about neurosurgery. They have good amount of exposure and cutting chances there. Just that again, the work-life balance will be very bad, but still you get a lot of cutting there. And after IPGMR, it will be Medical College Calcutta, and then NRC has 2 seats, which is also good. I mean, you get good amount of cutting there. And about other institutes, always about doing neurosurgery. It's better if you pick the place that is nearer to your home, and you get a good amount of exposure. Like what you can look for is how the department is, how many microscopes are there, and how the cutting chances are. It differs from centers. So if you're planning to go for a neurosurgical training, it's always better to do it in a better center go for right again than you what you can say, like you compromise on your choices. I think Dr. Balaji is also there. He will discuss further.
Okay. Balaji sir, are you free? Dr. Balaji Niro? Hello?
Yes, sir, I am free now. Can you hear me? Actually, I want to say about the colleges.
I think you are having so much of a background noise there.
Yes. Yes, sir.
Yes, sir. Anything you want to suggest for the students related to?
Firstly, I want to say
Balaji sir, there is so much of noise on your side.
Okay.
Sir, no issues, sir. If you are busy, I will add you afterwards. So much of noise is there.
Okay, sir.
Yeah. Rahul sir, pediatric surgery. Sir, anybody want to ask about pediatric surgery? Dr. Rahul sir is here, pediatric surgeon. Yeah, welcome, Dr. Rahul, pediatric surgeon leader.
Hello, sir. Sorry, sir. I'm traveling, so that is why I couldn't.
No problem, sir. No problem. Just
yes, regarding pediatric surgery, there was a lot of questions in Facebook and to my private WhatsApp numbers also, sir. Well,
okay.
First question was whether to take up the specialty or not. See, pediatric surgery is really a wonderful specialty. It is not like what it seems from outside. Okay, the only thing is in pediatric surgery you'll have to have a widespread knowledge of all the specialties. That is, a pediatric surgeon is not only an extended general surgeon, he will be a pediatric gastroenterologist, pediatric oncologist, pediatric urologist, and we will do a few pediatric neurosurgical procedures, and we even do pericardiotomies. So the issue is, we'll have to go into a college where you get maximum cutting chance, as sir has already told you. Okay, and even the previous years, the first question was, where do we get maximum chances? Which colleges are best? Now the questions coming are, is it a lucrative field? Will it be financially helpful? See, any field for that matter of when we put our work, we'll be able to do justice of a specialty. So we'll be able to have a very good living. Okay. With regards to colleges, there are only a few colleges which keep on getting chosen every year. One is with regards to Tamil Nadu, Institute of Child Health Egmore has always been in the forefront runner of all the colleges because of cutting chances, the volume load and everything. Because as I already told you, because we are going to deal with all subspecialties of pediatric surgery, we'll have to go into a hospital where you get exposure to all cases. Your pediatric urology is going to be around 40 to 50% of your pediatric surgery. So you have a good pediatric urological volume load. And most importantly, other subspecialties of pediatric surgery like newborn. See, pediatric urology and newborn only by pediatrics. So your Institute of Child Health will be a very good college to choose upfront. And CMC Vellore has been doing a very good job with regards to number of cases, your exposure and cutting chances. And coming to the recent advances, the advances are more into pediatric minimally invasive surgery. The laparoscopic work has been great. Laparoscopy and pediatric laparoscopies. Even pediatric urology has been dealt with mostly with laparoscopy in these centers. So you'll have to go based on the number of cases, your cutting chances, and also the exposure to various subspecialties. So with regards to Delhi, it is going to be Lady Harding is very good, and Maulana Azad is again very good, and Safdarjung Medical College because it gets lots of spillover cases. So these three are the major institutes with regard to Delhi. With regards to Bangalore Medical College is doing a good job, and Indira Gandhi Institute of Medical Sciences is an excellent, because Rameshwar is doing an excellent job with regards to pediatric minimally invasive surgery and pediatric urology. So as you come out, you should have at least one armamentarium, which is much better when compared to others. So pediatric laparoscopy will be the call of the day. So you have to go into a center where you get more pediatric laparoscopy. With regards to Kerala, Amrita Kochi has a pediatric surgical seat, and they are into fetal surgery. So if the future is into fetal surgery and pediatric laparoscopy, so Amrita will be a good option. And Kottayam, Kozhikode is again a good option in Kerala. These are based on regional interest. If you're more interested in a place where you want to choose in your state, then it's going to be Kottayam and Kozhikode. In Mumbai, it is Sage GS Medical College and Sion Mumbai are the colleges which have been repeatedly been chosen. And SMS Jaipur is doing a wonderful job. SMS Jaipur, a lot of pediatric urological cases that has been on the forefront. And Tamil Nadu, as I already pointed out, ICH is going to be a first option, and CMC Vellore is again doing a wonderful job. With regards to minimally invasive surgery, Coimbatore Medical College Hospital comes in the forefront because there is lots of pediatric minimally invasive surgery going on. And Madurai Medical College again has got a great volume and variety of cases. And the other colleges which are to be mentioned, there are a few seats which have been taken up. One is BJ Ahmedabad is again good. And Andhra people, if you're more interested into colleges in Andhra Pradesh, Osmania Medical College is again a good option for you. And Nilofer is doing a wonderful job, and Nizam and Telangana in this order. So Osmania and Nilofer, if at all you're choosing a college into Andhra Pradesh, will be good options. And then other colleges which are chosen are RML Medical College and PJMR RML. So these are in view of the cases. And always remember, the future of pediatric surgery is again more because there are lots of IVF pregnancies going on. You're going to get lots of anomalies. We don't pray for anomalies, but there is a higher incidence. So we'll be able to operate on neonatal cases. Neonatal surgeries can be operated only by a pediatric surgeon. Even though, see, go into pediatric appendix, this can be operated by a general surgeon, a surgical gastro, or a pediatric surgeon. But there are many innumerable number of conditions where only a pediatric surgical perspective will come into view, and there are lots of opportunities for you outside. The only thing is, as Rajamahendran sir cleanly pointed out, the vacancies in government are very bleak. If you look at Tamil Nadu, the vacancy for MCH pediatric surgery is nil at present. So you'll not be able to get into a government medical college. There's both a plus and minus. The plus is you'll be able to work outside immediately after your MCH. The negative is you might not be able to get an exposure post MCH, but the amount of exposure you get in these colleges in Tamil Nadu is more than enough for you to be a consultant. If there are any personal questions, I'll be able to take it up now, or my WhatsApp number is already in the group, so you can WhatsApp me personally also or in the group anytime.
Thank you, Rahul sir. Any of the students are going to be there in the group, you can clarify them in the WhatsApp group also, sir. No problem.
Sure,
Thank
sir.
you.
Sure, sir.
Thank you.
Thank you, sir. Thank you, sir.
Thank you, sir. Thank you. Please, I welcome Dr. Venkatesh sir, Urology, the most awaited session. Most of the students are waiting for you, sir, because they want to know up to what rank they can get a seat, etc. They are asking. So please clarify them.
Hello, sir. Am I audible, sir?
Yeah,
Hello?
you are very clearly audible, sir. Please go
Okay.
on.
Good evening, all. First of all, congrats to all our students here. It's really heartening to get so much of messages, and all of you are thoroughly deserving this ranks. And any queries and on outside, I think till last year the rank system was like each specialty has got individual ranks. If I'm not wrong, RRM sir would go ahead with
So one very important question, Venkatesh sir. Most of the girls who have got seat, they're asking future of female PGs taking urology MCH.
Sir,
many girls have got seat this year. They are thinking of taking urology.
It is not future anymore. It is already present and it's already booming. Because even when I had done my residency 5 years back, I had one or two female residents throughout in all 3 years. So there are so many. Even if you Google it, there are so many renowned female urologists are there, and now the urogynecology is a very upcoming, and it has already evolved into a very good subspecialty where they deal with all the female urinary incontinences, stress incontinences, the pelvic organ prolapse. There are so much innumerable conditions, and female urogynecology is going to be dealt mostly with the female urologist, because as we know in our city, our center, people are little hesitant to approach a male urologist for that matter. So female urology, ladies can definitely take into urology, because already there are so much of females who have been doing wonderful job in urology for that matter, sir. And as I was talking last year, as we say, there were around 350 to 400 seats in urology, including both DNB and MCH. Okay, and this question is little difficult to answer, because till last year, last 2021 counseling, there was separate ranking system for each. For gastro, there was separate ranking system. For neuro, there was separate ranking system. For Euro, there was separate ranking system. This time is the first time where it is being clubbed like a NEET PG. So again, it depends. It depends. What I have seen so far is like the priority depends between a northern state versus southern state. Whereas in northern states, still there are so many people who opt for urology just because of the sheer number of volume and lack of urology seats in North India. Whereas in South, the priority comes little less compared to gastro or onco, because already there are so much of urology seats in Tamil Nadu, in South Indian states. But to be frank, urology is a very good field. This I'm telling after 5-6 years of my urology practice. Like I'm talking about more of practically. The caseload is already numerous for urologists. However, see, people tend to say that now it is getting saturated. Saturation happens in every field for that matter. Okay, but the caseload is definitely good, and every urologist, even after 6 months of a freshly posted urologist, none of them are free. They are busy with their practice. Okay, so that by caseload and the remuneration, definitely urology is a very safer branch, and you can have a very relaxed branch for that. You can take my word onto it. Okay, and most of them would agree with it as well. Okay. And any questions? So order of priority, it depends. So usually the top rankers usually take this IKD Institute of Kidney Diseases and Research Center, Ahmedabad. Next SGPJ comes into picture, then CMC comes into picture, and as I would suggest, when it comes to urology, when it comes to government medical colleges, my advice is to take up the topmost priority college. For example, when it comes to Tamil Nadu, better to take for colleges where the urology program has been been there for long period of time. For example, MMC, Stanley, and Keelpark, they have been having this urology program for many years. So what does it mean is you already have a good amount of workload, and it has got a structured academic program. Okay, whereas coming to peripheral colleges in Tamil Nadu like Madurai, Coimbatore, Chengalpattu, everything has been coming up with a lot of urology seats. But when you have an option, better to go for the top rung of government medical colleges. That is definitely there. And there is one more trend is like now, even last year, I could see good rankers in urology opting for good DNB institutes, even when they had an availability of urology, MCH seats. So again, urology is one field where all the latest technologies being taken up. That means your robotics, your endourology, your minimal accessory, everything is being taken up. When it comes to apart from very good institutes, there are few DNB institutes who took up this specialty, who took up this advances more early. For example, the most of the people aspiring for urology would know about a place called Mulji Patel Institute of Urology in Nadia. That is what we call as a mecca of urology. Though it is a private institute, DNB institute, it is very, very good because they have all the things, including the robotics, and they are very much forerunners in the urology training program. And similarly, your Gangaram is very good. Your Apollo Chennai is very good. As already said, the cutting chances, the direct interaction and cutting chances is slightly less when it comes to DNP institutes, especially private institutes. But definitely you can go for it. And SMS Jaipur and KGMU is also excellent. They've been there for years together, and if needed, I can get some of our students who had previously joined last year and get you more information onto it. Okay. And till what rank? Again, it is a $1 million question. Only this by end of this counseling, we know what is the priority of students who've been taking up. Manipal Urology is good, but again, I think it's a private college, and Manipal Institute is known for
Delhi urology students are asking, sir. Delhi urology.
Yeah, Delhi Safdarjung. The Safdarjung is the one which most of them prefer to it.
Whether they can get within 200 rank like that, they're asking. Trivandrum urology.
So that 200 rank, we cannot tell, sir, because last time every specialty had their own rank list. Now it is a club rank list. So definitely 200, definitely you are going to get, because that depends upon the priority of students who are taken above. So on a safer zone, anywhere between 700 to 800 ranks, definitely you can get a decent urology seat. That is for sure.
Trivandrum is best for Kerala urology, no doubt.
Yes, sir. Yes, sir. Yes, sir. And as I said, females can definitely take up urology because, and remember, 60 to 70% is your endourology, is your stone work. So that doesn't matter whether you're a male or female. And female has an advantage when you take up urogynecology. That is because you have got, you can, most of them may have some gynec exposure as well. That will definitely help you to build up your practice.
Thank you, sir. Thank you.
Yeah. And any doubts, you can message me.
You can always post in the WhatsApp group. We are all there. You can always post in the 1 to 1000 rankers group. We'll be answering that.
Because many other faculties are also waiting. I don't want to take up so much of time. And again, wishing you all the very best, and we'll be in touch anytime.
Thank you. Thank you, Venkatesh sir, for spending your time. So thank you, Balaji sir. Thank you, Nilesh sir. Thank you, Venkatesh sir. Thank you, Sajid. You can all carry on because other specialties are going to talk. So if you have work, you can carry on. Otherwise, you can observe. Thank you, sir. Thank you. Welcome, Dr. Imran. Are you there? Please join, Dr. Imran, plastic surgery.
Yes, sir, I am there.
And Dr. Vijay, our team plastic surgery. Are you there, Dr. Vijay sir? I think Dr. Vijay sir is not there. Please carry on, Dr. Imran. You can tell about the colleges and the scope.
Yeah. First of all, I want to congratulate all the students who have passed this NEET exam.
Please, you can switch on your video if you are possible. If you can switch on your video.
Yeah. And
thank you.
Yeah. The most important thing when you are choosing a plastic surgery, that what type of the future you are thinking of, whether you are thinking of a government job, as sir has already discussed, what is the steps of when you are choosing what a branch, where you are choosing a government job, where you are thinking of a private job. And in private job also, whether you are thinking for establishing your own establishment or you are thinking for joining some corporate hospital. So because plastic surgery is a diverse branch, there are so many subspecialties are there. You can go for cosmetic surgery, you can go for hand surgery, then onco reconstruction, then trauma reconstruction. There are so many sub branches are there. But what I feel that whatever institute you choose, it is ultimately your decision, what subspecialty you want. Because if you see currently in practicing cosmetic surgeons, most of the cosmetic surgeons during their PG, they may be not having so much exposure to the cosmetic, but now they are doing wonder. Similarly, if you see the onco reconstruction surgeons are there during their PG time, we have so few exposure to the field, but ultimately it is our interest that we have to build up. So as far as plastic surgery, good colleges are concerned, you can go for the Delhi Institute, all institute in Delhi, where there is a Safdarganj or other institute. Or in the south, you can opt for the Stanley Medical College. It is very good for hand surgery. You can see so many hand cases are there. Then Osmania Medical College, Saint John Medical College. For onco reconstruction, you can opt for Tata also. Tata, you will have the onco reconstruction. So many cases is there. Others colleges are, I think.
How is Ganga for plastic, sir? One student is asking, how is Ganga for plastic?
Ganga is very good. You will see variety of cases, particularly for hand cases. You can see transplant cases also there. So Ganga is also very good. But ultimately, what I think, sir, it is our that students' choice. What students want ultimately. We will see variety of cases. One or two, if you see cases, then you have to develop your own skill. So I think that much already. So it is already, I think, 9:15. Let the other faculty talk about. If you have any,
you can afterwards you can post about the scope of SMS Jaipur, NIMS Hyderabad. They're asking about these colleges, sir. Because Dr. Imran is from JIPMER, so let him also analyze the other important, interesting colleges. He will post it soon. Okay. So about Tanjavur and all, they're asking, sir. Jaipur.
Jaipur is also very good now. Plastic surgery is very good there, but there are so many number of PGs are there. So cutting chance will be get rotation wise, but it is good only, sir.
Okay, sir. Thank you, Imran, sir. Thank you. Thank you so much. So anyhow, we will be clarifying other doubts in the WhatsApp, so don't worry.
Other doubts, they can post me on WhatsApp.
Yes, sir. Yes, sir. You can also personally mail, sir. He's there in the WhatsApp group. In our group, he'll be there. Okay. So Dr. Murali, sir, welcome. Cardiothoracic and vascular surgery. Sir is going to explain about Dr. Murali, sir is our vascular faculty. Please unmute yourself, sir. Unmute. Yes, sir.
Hello, sir. Good evening.
Welcome, sir. Welcome. SKR, sir, is not there. Saravana Krishna Raja, sir.
I couldn't see him, sir. I couldn't see
I'm
SKR,
also unable to see him. So no problem, sir. Anyhow, you can explain everything related to PTDS.
The thing is, I will first finish vascular surgery part. So there are nearly 20 seats of vascular surgery in MCH in NEET SS and 29 seats in DNB vascular surgery. So whenever you are taking up DNB vascular surgery or MCH vascular surgery, many of them will have a confusion of whether to do vascular surgery or cardiothoracic vascular surgery. So cardiothoracic vascular surgery, what we do is we do open and as well as endovascular. We do stenting, we do angioplasties, angioembolizations. Along with it, we also do open bypass surgeries, right from aortic surgeries, FEMPOP bypasses and distal bypasses. So it is people who have already been exposed to vascular surgery, they will know what kind of work they do. And each center has its own pros and cons. It's not just like every other institutions, as Balaji sir and Rajamahendran sir have previously said, each institution will have specialization and subspecialization. So the thing is, if you have to choose an institution, and if the institution now it is like the age of endovascular procedures, you do lots of endovascular procedures, and you do comparatively lesser number of open procedures. It's not that you should not have it. You should have an equal exposure of both open as well as endovascular exposure. So in Tamil Nadu, you have around 18 seats of vascular surgery, and in Karnataka, you have 2 seats in MS Ramaiah Medical College. In MMC, you have 6. In Stanley, you have 2. In Madurai, in Tanjavur, you have 2 each. You have 2 seats in CMC Vellore, 4 seats in private medical college, 2 in SRMC and 2 in Savita. So that makes it 4 seats in MCH vascular surgery in private. Apart from that, you have DNB program in North, that is in Gangaram, Apollo, Indraprastha, Medanta. In Bangalore, you have Jivas and Narayana. In Telangana, you have CARE Institute and Nizam and KIMS. They have vascular surgery courses. And in Delhi, you also have R&R Hospital. Each have their own, their DNB institutes are more good in endovascular procedures because they get to have a lot of hands-on on high-end gadgets. And teaching government institutions in Tamil Nadu medical colleges, all the institutions equally, they have very good number of open surgeries. They have very good number of trauma cases. You will have umpty number of trauma cases. You will feel tired of all these trauma cases. So all the institutions are equally good in vascular surgery. And in from coming to the endovascular perspective, Ramaya and other SRMC, Tanjavur, every MMC, Stanley, all have their own cath lab along with CMC. They all have cath lab. They do their own endovascular procedure. They do their EVAS. And if you are very interested, if you're very interested only in endovascular procedure, try to go for DNB vascular surgery, but you will have very less chances in open cutting surgeries. But if you want to have good mix of both open and endovascular procedures, I think it is good if you take any of the government institution. The private institution can be a next choice. My personal choice, from whatever I have seen and heard, because of the faculties who are there, my first choice would be any of the government medical colleges in Tamil Nadu is all good. And coming to the DNB, the Gangaram, Jivas and Narayana Hridayalaya, they are like standout institutions coming to vascular surgery. Medanta is also good. And rest of the institutions will fall after this. And so first choice is MCH in any of the government institute. Second choice would be a DNB in Delhi, Gangaram, Medanta, Jivas, Narayana in Bangalore. And the rest of the institution will fall after that. If there is any specific queries for vascular surgery, I'm happy to answer. And SKR sir is here and he's there to help tell us about the cardiothoracic surgery seats and availability and stuff. Sir?
Yes, thank you, Murali sir.
Yes,
thank
sir.
you,
Welcome,
sir. Thank you, Aravind sir. Thank you, sir.
I welcome Dr. SKR sir, a heart transplant surgeon from Madras Medical College. He's the professor there. He's going to explain about cardiothoracic scopes. Okay. Yes, sir. Please, sir.
Hi, everyone. Good evening. Thank you so much, sir. Dear students, so cardiothoracic surgery is one of the biggest fields, as everyone know, but it is a very, very little known field also. So a dream of every student before entering the MBBS degree will be to become a cardiothoracic surgeon. Then after the due course, the interest may become weak, and because of the practice. So immediately after completion of the specialty course, so everyone wants to practice. And general myth is regarding the cardiothoracic surgery. In the previous years, it has been known that only institute-wise practice has been followed in our field. But what the trend nowadays, each and every district will be started having its own cardiothoracic setup. So cardiothoracic surgery is one of the upcoming field. And regarding the subspecialty in cardiothoracic surgery, everyone can get trained in a thoracic part. There is available the aortic surgery parts and the mixed invasive and robotic surgery part. So I got trained in MMC in Tamil Nadu. See, after my MCH post-graduation, I started my practice as an individual cardiac surgeon. So it always depends upon in which college you are practicing. My suggestion will be, if you are really interested in cardiothoracic surgery, try to select colleges like government colleges, especially. My suggestion will be MMC in Chennai. So everyone will get good hands-on in cardiothoracic surgery, and definitely after completion of their post-graduation, you will have a good capability and confidence about you. Then next, regarding thoracic surgery, there is available the Medanta and the Sri Gangaram. That especially thoracic surgery part or that. So you need not to study the cardiac surgery for along with the thoracic for 3 years. Depending upon the seats, my suggestion will be, students, if you are interested in cardiothoracic surgery, try to select colleges with more number of seats so that you will be having colleagues, you will be sharing duties, so that you will be having duties on every other day. So it will be good for you. And dear aspirants, colleges like MMC, Sri Jaydeva, and few colleges in Delhi like Medanta and Gangaram are very, very good colleges where you can good really hands-on, dear friends. So if any doubts regarding the selection, you can ping me at any time.
Yes, sir. Thank you, sir. So as of now, so if you have any further doubts, you can post in the groups. So I will be ready to answer at any point of time. Thank you, sir. Thank you, Murali sir. Thank you, SKR sir. You can just carry on. Good chance to get a vascular seat at 1,100. People are asking, but
sir, just message. Last time it was individual rank. They got till 350 ranks, But 1,100 should not be it should be, he should stand a good chance to get a seat.
Okay, sir. Okay. Thank you.
Okay, sir.
Thank you, sir. I'm just giving a review of whatever we saw so far. So please remember the number of seats totally available in gastro is 129. Number of seats available in onco as of last is 207 seats. And urology is having the highest number of seats, 393. Neurosurgery, 279. Pediatric surgery, 63. Plastic and hand, 185. CTVS is having 107 seats. And finally, there's endocrine. We don't have a faculty to discuss about endocrine because it's a newly started course. We don't have a good faculty to discuss about this session here. So, but please remember endocrine surgery, there are only 10 seats. If you are very much interested in doing a endocrine surgery, thyroid, adrenal and parathyroid, these surgeries, you can always go for endocrine surgery. But the major issue, what we feel is most of these endocrine surgery cases are already taken by these oncosurgeons, thyroid surgery, parathyroid, even this adrenal surgeries are also done by oncosurgeons, and even general surgeons are taking up thyroid surgery. So the scope in practice is little average compared to other courses, but you can have a comfortable, cool and casual life when you go for endocrine surgery, especially if you are very much interested in thyroid surgeries, you can always take it. But there are number of seats is very less. As of now, the number of seats are very less. Only some 10 seats are available. Please go for endocrine surgery if you really like the seat. Don't worry about the future scope and practice and all, but this is the situation. Okay. So as of now, to conclude, I'll tell you, if you are going to get a rank between, 1 to 300, definitely you'll get a gastro. 1 to 300, but I cannot say whether it is a DNB or MCH or a private. Up to 300, you can get a gastro seat. Up to 500, 600, you will get an onco seat. You will get an onco seat. So I already told you, if you are interested in onco, take it. Don't worry about the various issues. If you are going to get a seat, just take it. And urology will be available up to 750, even up to 800 ranks. Neurosurgery will be available up to 1,000, 1,200 ranks also. And plastic will be available up to 1,500. And other specialties will be available up to 1,800. So you can always select whichever you like. You can always go for those seats. Don't hesitate about the college, institute, and all. Don't worry, because in MCH, we never get any training. Please remember, in MCH, we just observe. It's most of the colleges, it's only an observer course. We have to observe, we have to assist, that's all. No colleges, at least 70% of the colleges will never give hands-on. You have to only observe and you have to come out, learn and learn and learn and keep on learning. That is MCH. So therefore, don't worry about cutting chance, etc., etc. If you're going to get your passionate degree, please take it. Okay. So thank you all for attending the session. It's a very nice session. Around 500 students attended the session non-stop. This video is available in the YouTube in Dr. Races also. So you can always join there and you can see the session. And we will be there along with you in the group also. You can always post your doubts to the corresponding faculties. You can post the doubts in the session. Thank you, sir. Dr. Balaji, sir, anything you want to complete? We will complete. Thank you, sir.
Yeah, it's a great session. I think we were able to clear most of the common doubts which were there. Again, individual ranks, individual rankers. Ultimately, just remember that even we do not know how the rank distribution will fall. It all depends on the previous candidates who are selecting. There may be a number one ranker who may be interested in urology or even in endocrine surgery or plastic surgery. We never know that. So that will decide the ultimate chances of anybody getting the MCH or DNB seat of their choice. And again, general preference is for MCH, though DNB is also a good seat depending on the institute. So go by what your heart says. My personal comment, do not spend a lot of money in the fees, because it is not worth it spending a huge amount like 1 crore or something on the seat or anything like that. So all the best, my friends. I'm sure all of you will get the seat of your choice, and don't be disappointed even if you don't get it. There is still INISS to come. There are still further exams to come. So don't be disappointed even if you don't get it. And sometimes in life, getting a second choice may be a better option as well. So general dictum, you go for the specialty first, have an order, roughly speaking, based on what we have told you and what we'll be answering in the group later on. Second thing, you also have a second subject of choice. Just don't go by the, suppose there is a person who wants to have gastro, you may think about getting a good onco institute as well. So that is another option as well. So think about all this, then make a choice and go ahead with that. Thank you.